Morning, Queensland. So, in good news, overnight, we've only had one new case which is overseas acquired, and it was an Emirates flight crew member, and they've actually departed Queensland. We only have 23 active cases, and in the past 24 hours we've had 7,410 tests, so once again, well done. Well, what this means, of course, yesterday we said we were on 100% track to have our restrictions lifted at 1 a.m. tomorrow morning, and I can confirm that is exactly what is going to happen at 1 a.m. tomorrow morning. So what does that mean? It means that we actually go back to our roadmap from December. So, for example, gatherings, 50 people will be allowed to come into your own home, 100 people in public spaces. We go back to that 1 per 2 square metre rule in our pubs and cafes and in our restaurants, which is great news. But can I also remind everyone, don't forget to continue to leave your contact details at these venues. It is absolutely critical that you do that. For people having a wedding this weekend, 200 people can attend, and of course all guests can dance indoors and outdoors, and funerals also up to 200 people. So this is wonderful news today, and look, can I sincerely thank the people of Greater Brisbane in those local government areas of Brisbane, Logan, Ipswich, Redlands and Moreton. You have done an absolutely terrific job. And because of that, it means that the masks also can come off, except, of course, where National Cabinet has mandated that the masks must be worn in our airports and on planes. So that was a National Cabinet decision. So please remember to do that. But also too, we're asking people that, you're encouraged, if you are going into a crowded area or on public transport or in a shopping centre and you can't socially distance and you feel uncomfortable, just put a mask on. I mean, you can do that. That's entirely up to you. So once again, absolutely tremendous news today. Thank you so much for everyone for your hard work, and I also thank Dr Young for her advice in continuing to keep Queenslanders safe, because at the end of the day, I think that there'd be a lot of other places around the world that would be very envious of the lifestyle that we have here in Queensland. I want to preserve that lifestyle for many years to come. And of course, as we go through the rollout of the vaccine in months to come, I think it's very important that we think about the journey that we've all been on over the past year, where our lives have changed. But we've come through this together, we've come through it stronger, and we will continue to do that every single day. So I'll hand over to Dr Young.
Thank you, Premier. So that is excellent news. So today we're 14 days from when the last case related to that cluster went into quarantine, and we've done an enormous amount of testing throughout Greater Brisbane, and we've not found other cases, so that is really good. We did see those 3 initial cases all transmit to their closest contacts, so that gives evidence that this is a particularly infectious strain. So we had that initial gentleman from the UK who gave it to his partner, we had the cleaner who gave it to her partner, and we had the lady who returned from Lebanon who gave it to her father, because they were staying in the same room. So we saw that, but we haven't seen any further spread, which is fantastic. So we're now 14 days, which is then time that we can remove all those restrictions. But it is particularly important for the next 14 days that here in Greater Brisbane, anyone with any symptoms at all, please just come forward and get tested like that cleaner did. She is to be absolutely commended for what she did and for the assistance she's provided throughout. She really and truly helped enormously. So in the end, we had over 1,200 contacts, and they were all managed, and none other than those 6 that I've described went on to get infected, which is a really good sign that our strategies have worked here in Queensland in terms of people maintaining that social distancing and maintaining all of those strategies to limit spread. The most important one, though, is if you have any symptoms at all, doesn't matter where you are in the state, because we don't know what might happen, just come forward and get tested. It's really important, and in most cases we can get results to you within 24 hours, so you need to remain isolated then till you get that result. But then, if it's negative, you can go back about your normal business. Thank you.
So with the great news of one new case from overseas that we've received in the last 24 hours, that brings Queensland to 23 active cases, and we've had 7,400 tests in the last 24 hours. So once again, thank you to Queenslanders and people visiting Queensland for coming out and getting tested when they are feeling unwell. And we not just want that to continue, we need that to continue so we can move forward as far as opening up our economy. So from 1 a.m. tomorrow morning, we will be back to having amongst the lowest restrictions in our economy in the country. This is great news for business, great news for tourism, and it's great to celebrate for the people of Queensland that they've done such a tremendous job in complying with these restrictions. We know it wasn't easy, particularly the 3-day lockdown, but this has shown to have great results, and we're all being rewarded for that with the lifting of restrictions at 1 a.m. tomorrow. So reminding people, it means 1 per 2 square metres, indoors and outdoors at venues, pubs, clubs, hotels. Dancing is allowed. You can stand up and have a drink with friends in those venues. We are, of course, meaning with these lifting of restrictions, 100% capacity back at allocated seating venues. So our outdoor stadiums, our theatres, our cinemas, if there is allocated seating, then you'll be able to go back to 100%. So this is wonderful news for everyone. Please keep up the testing. It is really important, and stay home if you're feeling unwell. Of course, social distancing still applies, and also making sure good hygiene. So washing your hands regularly, sanitising, reminding businesses, keep that sanitiser there. Reminding supermarkets, keep those wipes there for people to wipe down shopping trolleys, and carry a mask with you. So if ever you find yourself in a situation where you cannot socially distance, whether you're on public transport, shopping centres or anywhere else that you feel that it's a crowded environment, you have your mask with you and you can put it on to feel a bit safer. And also it's about protecting the people around you. So thank you to all Queenslanders for their cooperation over the past 14 days.
Good morning. So in the last 24 hours we've seen 3,206 passengers processed through our domestic airports and 4,226 cars met at our borders. Only 29 persons refused entry and 53 into quarantine. The good news is that we're seeing a continued downward trend in our hotel quarantine numbers. That's now down to 2,795, and that's a reduction of over 600 since the beginning of the week. In the enforcement space, only one enforcement action, and that was at Wallangarra for false declaration of person coming out of a hotspot. No actions whatsoever in relation to the restrictions in Brisbane, which brings me to the point to say thank you, as the Premier as the Minister have, to everyone for the work they have done. You've made the lives of our police officers and partner agencies much easier. The compliance in Brisbane has been really quite outstanding. So to those people in the southeast corner, thank you very much for your work there. But a timely reminder that no complacency, please. We are coming out of the more restrictive regime into a new regime, which we were in December, but that means there are still restrictions. So obviously our police and partner agencies were out and about making sure people are still doing the right thing, and that puts us in great stead to stop the spread of COVID should we see any other outbreaks. Thank you.
How soon might it be, Premier, before restrictions are lifted altogether? That is, restaurant, bars, weddings, funerals, that sort of thing.
I think that whilst we're still in this pandemic, we won't see the likelihood of any further easing until the vaccine would be my understanding. But of course, these are issues that are open for discussion at National Cabinet, and we will take the advice of AHPPC.
Premier, moving forward, what's the criteria if we do have linked cases again, or say a cluster? What will trigger? Will we go back back into a lockdown like we've seen? Like, what's the criteria? What will happen long term?
Well, as we know, this UK strain is highly contagious, and of course we're seeing what's happening around the world. So we had reports the other day about hospitals being completely overwhelmed in the United Kingdom. We don't want to see that here, and what we do know now is that the international flights that are coming back, the caps are being lowered, which I think is good news. It means that everyone can manage what's coming in at the moment, and also making sure that that quarantine is really strong in our last line of defence, because the last thing you would want to see is that UK strain embed itself in the Australian population, because it would cripple our economy.
So another lockdown could happen?
If that is the advice of Dr Young, to go hard and go quickly, we would have to do that.
On Tuesday you announced that international flight crew would be sent to those who are quarantined and tested. Why wasn't that happening all along?
Because this was discussed at AHPPC, and then it was raised at National Cabinet, and the National Cabinet took further measures.
But that doesn't really answer my question. Why weren't we doing that from the beginning? If they're bringing this highly infectious strain to the country?
Well, you should ask the Australian government.
Premier, what are your thoughts on Gladys Berejiklian's idea for a Pacific bubble?
I haven't heard that, but once again, they would be matters for National Cabinet to discuss, and international borders are it's for the national government, federal government, to make those decisions.
And a decision on Greater Sydney?
Next week's my understanding. Next week.
Next week.
Yep.
Do you think local councils should have a seat at the table at National Cabinet?
Sorry?
Do you think local councils should have a seat at the table at National Cabinet?
The local government association actually came to our meeting in December.
Premier, how do you regard Frankie Carroll, and did he do a good job for Queensland government?
Sorry?
Frankie Carroll, he's taken a job in Melbourne. He was the under.
Well, I wish him all the very best.
Did he do a good job for the state?
Yes, he did.
Will you miss him, do you think? How did you regard him?
Sorry?
How did you regard him?
Well, public servants move around. They move around to different jobs. People from the federal public service come here. People from here go to the federal public service. People move around all the time, just like journalists move around all the time as well.
Can you tell me what you made of him?
Oh, look, I'm not going to comment any further.
For business confidence going forward, can businesses across Queensland be confident that we won't have...
Well, I think they should be confident, like the Health Minister said, that we have some of the lowest levels of restrictions in the country, but also in the world. At the moment, I get reports that businesses aren't operating. They're shut down because they're in lockdown in many, many countries across the world. And if you don't have a strong health response, you can't have a strong economy. There's nothing more certain than that. And what we've been able to see here in Queensland is that we've been able to ease restrictions faster because we've had a strong response to tackling COVID in this state.
There is a case of the Gold Coast of a man who's stuck in Sydney whose house has been trashed, ransacked, broken into, but he can't get an exemption. Is that the sort of case that maybe they should be shown a little bit?
Lane, I'm not aware of that case. I'm happy to refer that to Health to have a look at. Yeah.
Dr. Young, can I just ask you how you would describe the situation in Greater Sydney at the moment? Are you confident that travel won't be allowed there again soon?
Yes, they're getting on top of all their clusters. So we've seen a whole series of clusters, which has been an enormous amount of work for them, but each one they've got on top of, and this last one it looks like they're getting on top of. So it's very encouraging.
Are there any unlinked cases though that you're concerned about, or have they all been largely unlinked?
There are some, but they are working those through, and gradually they're finding those linkages.
From your perspective, what would trigger another lockdown in Queensland, similar to what we've just had?
It just depends what happens. We just have to take each individual situation and work out what is the best response for that situation. We're still in the middle of this pandemic. We're getting more and more information from overseas about these new variants and what that means. But at the same time, while we've got that information, we're getting information on the vaccine, and that's very, very encouraging. So we just have to wait and see where we are if we get another case, where we are in terms of rolling out the vaccine, where we are in terms of numbers. There are so many variables that we just have to look at.
And do you feel like we've learned quite a bit about the UK strain recently as part of this lockdown process? Does it mean if we have one more UK strain, we're less likely now to go into a lockdown?
I can't really comment. It would just depend where we are at that point in time, but it was very encouraging. The most encouraging part of the response was how quickly people in Greater Brisbane responded. It didn't take long to get that message out there. I don't know that I've ever seen that in my career, that you can stand up and ask people to do something and people immediately do it. So that's thanks to all of you. I mean, as a media group, I hope that you go back one day and review how you've played your role in this pandemic and just done it so brilliantly in terms of getting information out there. It's astounding.
What's the condition of the hotel cleaner and her partner now? Are they recovered?
I don't have those details, but they were never particularly unwell, which you would expect given their age and their situation. But I do comment that both of them were fantastic in terms of their cooperation, their full process that they worked with us as to where they'd been, and also they really weren't out in the community very much, so it helped enormously and limited the number of contacts.
Have you had any interim reports on the samples taken at the Grand Chancellor or the air conditioning situation?
That's with police, so police are working through the investigation.
Dr. I have to double check. Are those visitor restrictions on aged care in hospitals and prisons also lifted?
Yes, as of 1 a.m. tomorrow, all of those restrictions are lifted, except, of course, if you've come from a hotspot or you've come from overseas, then you can't go and visit till 14 days quarantine.
Just on Australia Day celebrations, are you aware of any COVID-safe plans in place in terms of, there's some of those protests and things like that going on?
So the COVID-safe plans will go to each of the public health units. So if they're more than that 1,500, remember we lifted the restrictions in terms of the numbers you could have. Before you needed a COVID-safe plan, you just need a COVID-safe checklist. Above those numbers, up to 10,000 people, it goes to the local public health unit. Above that 10,000, it comes through to me. At this stage, I haven't seen any.
Can I just ask of this issue? How close is Queensland to moving on shield laws for journalists?
Well, I'll have to talk to the new Attorney General, Shannon Fentiman, about that when she's back.
Would you, do you favour it?
Sorry? Oh, yeah, we said that we would look at the proposal, and I don't have a problem with it.
So you don't think it's fair that the journalists doing their job, sticking to the code of ethics and not revealing their sources should be jailed?
Look, I'm not going to comment till I see the final details of the proposal, so I'd rather get advice. First, I'd get advice from the Attorney General. Okay? Yep, last question. Yep, thanks.
Just on the rapid testing kits being manufactured in Queensland that the government's contributing funding for, do you think they're safe and do you recommend their use?
Of course I recommend their use, and they're fantastic, but they're not appropriate at this point in time in Queensland because we have got so few cases, so I always want to use the most sensitive test to pick up a case. So they're not as sensitive as the tests we currently use, and we don't have any capacity problems. We can run through enormous numbers of tests, a lot more tests than we've been doing. So I would prefer for Queensland to use the most sensitive test that's available, given we've got the capacity and we can do that, but it's a fantastic piece of work. I absolutely commend those people who've developed those tests.
Would they be in use when there's less cases to test or there's less threat?
No, you use them when you've got a lot of cases and you want to try and pick up the majority, whereas I actually want to pick up every single case. I want to pick up the first case in a cluster, not the 20th or 30th. So that's the difference, and also because we've got the capacity, our pathology labs can do all of those tests through that usual process, so we don't need it. The other issue with them is they take longer to actually do at the time because you're doing it immediately and getting the results, whereas we can do a very, very quick swab and send it off to the lab to be done. So it's a quicker process for our situation, but for other countries they're very, very appropriate.
Dr. Young, in terms of the around Queensland. Have you sort of like worked all that out yet?
Yes. So initially with the Pfizer vaccine, we'll be delivering it from major hubs because of the cold chain requirements. Once the AstraZeneca vaccine is approved, we'll be able to distribute it more widely throughout the community.
So the second vaccine is likely to be the one that goes out into the regions?
Into the more remote regions, yes. Yeah. All of those details are still being worked through, but that's the gist of the plan at the moment.
When you talk about hubs, do you mean doing vaccinations at stadiums?
Not necessarily, no, probably at our large hospitals.
Thank you.
Okay, thank you everyone.